One of the most common areas people are looking to improve is the tear trough or under eye area. Whether it's volume loss, dark circles, sallowness, fine lines, wrinkles, under eye bags, you name it, people are always commenting and wanting improvement of the under eye area, whether they're in their 20s, 30s, 40s, 50s, 60s, and beyond. What if I told you that there's a safer alternative to filler to rejuvenate this area, especially if there's volume loss that is allowing us to make a continuous transition between the eyelid and cheek junction without the limitations, side effects, and complications of tear trough filler? So up to this point, our options as aesthetic dermatologists to rejuvenate the tear trough area or to fill in and correct volume loss in that area has been tear trough filler, which recently got FDA approval just a few years ago, but practitioners like myself have been doing tear trough filler for almost 20 years now, and it just recently got FDA approval and is now becoming more common and acceptable. So tear trough filler in that area, fat transfer, which usually includes OR, anesthesia, a plastic surgeon, and a more involved procedure with harvesting the fat, and is usually accompanied by a facelift or brow lift or another type of plastic surgical operation. Or PRF or blood products that have traditionally been getting a lot of hype on social media and in the media, but really don't have long-lasting results. So things like PRP, PRF sound sexy and sound amazing, but when it comes down to it, they usually really don't last very long and the results are very underwhelming. So recently, I've been hearing a lot about EZ Gel, not on TikTok, not on YouTube, but at our academic meetings within the medical community. So when I'm giving lectures at the podium and we're at these academic derm conferences, it's gotten a lot of positive feedback. So I wanted to look into it because I can hear people's opinions and I can read, different comments and reviews on different procedures, but I really, as a provider, want to experience this procedure with my own patients, with my own hands, and really see, what the data is and if it is a worthwhile treatment. If a procedure, whether it's a laser or a new technology, is getting a lot of hype, I usually test it myself. I look through the clinical trials. I read all the peer-reviewed journal literature articles on the product or the treatment, and then I incorporate it into my office and I actually test it out on real patients, of course, who consent to kind of be my test subjects for these procedures. And when I heard from some well-esteemed colleagues who I really admire and respect in the field of cosmetic dermatology, and I heard about EZ Gel and how it was a safer alternative to filler, because in this day and age, we're kind of shying away from more filler treatments in aesthetics and going to more natural biostimulatory induced procedures with more natural, longer lasting results. So I was, really eager to try it out and was very, very pleased with my initial patient who I treated. And now I'm going to be treating a few more, but I promised you guys that I would do a review video on EZ Gel as a safe alternative to tear trough filler for under eye rejuvenation. So I think the trend now that we're seeing is moving away more from dermal fillers, which I'll do a whole other video on dermal fillers, but I feel that we are getting out of an epidemic where less qualified injectors were giving too much filler, using the wrong product, injecting it in the wrong dermal plane and doing way too much too fast. And I feel like we're getting out of that era where people had pillow faces and had puffy eyes and was changing the shape of their eyes. Also with tear trough fillers, you can have migration, you can have the Tyndall effect, you can have other complications, which, don't get me wrong, as a provider, I do tons of tear trough filler every day in my office, but I also am going to be offering EZ Gel as an alternative for people who aren't candidates for tear trough filler or for their own personal reasons don't want to have tear trough filler or any type of filler for that matter. And I feel like as a laser and a device girl, I'm more in tune with lasers and biostimulatory treatments that are going to naturally induce your own collagen production in your skin with longer lasting results. And now that I'm 47 years old, now that I'm older, I do these treatments for myself, all biostimulatory treatments with either lasers or energy-based devices. When I was younger, in my 20s and 30s, played around with fillers. I was putting fillers in my lips, my temples, my cheekbones, all the things. But now that I'm older, I shy away more from fillers and I'm looking towards more natural collagen banking and collagen stimulating stimulating effects for aesthetics and rejuvenation for myself and for my patients too. And I feel like this is a trend that I've been seeing even with my younger patients in the office. So I'm really excited to talk about EZ Gel as a biostimulatory using your own autologous blood products for rejuvenation. And I feel like the most common area where we're seeing it is for tear troughs, but we could be using it, we're using it in all areas of the face, temples, even lips, nasolabial folds, and marionette lines, everywhere. But I feel like tear troughs is the most common area and where it really shines as a product because the alternative filler usually has a lot of complications in this area. Again, when you're talking about fat transfer, lower eyelid surgery like a blepharoplasty or other treatments, I feel that, EZ Gel is not going to be an equivalent comparison because a surgical procedure is going to give longer lasting, more sustainable, more impressive results also. But it also comes with the risk of side effects, and surgery may not be for everyone, whether if they want fat transfer or a lower lid blepharoplasty. So I feel like EZ Gel is a great option for people who want a more natural approach, a more subtle outcome, and a safer alternative. And again, I'm not saying that it's better than filler. I still inject filler every day in my office, but I wanted to do this video to give, my impression of this treatment for under eye rejuvenation. So what is EZ Gel? EZ Gel is a combination of your own blood products and a process in which it gets spun down in something called a centrifuge, and it gets cooled and heated in such a way that it provides your own body's stem cells, growth factors, and platelet-rich fibrin that is actually different than regular PRF or platelet-rich fibrin or PRP, which is platelet-rich plasma. And the way it is different is the way that it's processed. It's a cooling and heating temperature process that enables a protein called albumin in our own blood to provide like a scaffolding that allows the product to last longer. Now, traditionally, PRP and PRF, platelet-rich fibrin and platelet-rich plasma, were removed from a blood draw, and you'll see it on like the vampire lift and the vampire facial. And if even some of you guys have had PRF injected into the tear trough area, yeah, it sounds great and it gets a lot of hype, but there's no really sustainable results. And if someone can drop a comment in the comment section and say they had sustainable results from PRP or PRF without EZ Gel, then I would be interested in hearing, because among the people that I've spoken with at academic meetings and among the medical literature that I've read and seen anecdotally as well, it really doesn't last more than a month or two. And so the problem with traditional PRP and PRF up to this point is that it sounds great, it looks amazing, but it doesn't last. So the way that the EZ Gel is processed with this heating and cooling preparation and algorithm of prepping the product provides the albumin with a certain scaffolding, which is like a structure, like a structural support system that allows the product to stay in effect longer. So I think the clinical trials said 8 to 10 months, and then anecdotally people are saying that it lasts longer than a year. So we had the company come to the office, and when I was talking to the representative from the company, he was saying for about 1 year we're seeing results for up to 1 year, which is longer than PRP or PRF in and of itself. Dermal filler usually lasts about 1 to 2 years, sometimes 3. It all just depends on the person's metabolic rate, and it could vary on a patient-by-patient basis. So I don't feel like the EZ Gel lasts as long as tear trough filler, but it does last for about a year when you have a series of 3 treatments spaced about 1 month apart. So what do I mean when I talk about scaffolding? So scaffolding is when you take denaturing proteins and reassembling proteins, is basically like saying breaking them apart and putting them back together again. So if you imagine a bunch of paper clips, think of a bunch of paper clips sitting like in a cup. They're going to slip and slide on each other, and they're not going to get tangled up. Well, they won't get tangled up too much, but they'll stay kind of individualized. If you take the paper clips and you unbend them and you change the structural configuration of the paperclip, and then you mix them all together like in a plastic bag, they're going to be all hooked on each other and providing a different structure than they did when they were individually kind of folded up. And this is what happens with the albumin protein in our serum. So when we come in for EZ Gel treatment, you have a blood draw and they process the blood components. And the albumin, which is a protein in our blood, provides this structural scaffolding because it's getting heated and cooled in such a way that it's unfolding those paper clips and putting all the paper clips all kind of assembled together in a way that it's going to last longer, and it's going to allow the PRF product to last a lot longer. So tear troughs, under eye dark circles, and if there's like a level of volume loss between the eyelid cheek junction, that will be smoothed over, that will be filled in. The orbital rim won't look so skeletonized. If you have dark circles under your eyes, those will be brighter. And I actually had one patient who I treated about 1 month ago, and she only had one treatment, and she came back with sustainable, amazing results. And I can't wait to give her her second and then her third treatment, and then just kind of track her progress throughout the year. And I'll share those results with you. Like I said, if something's gonna be offered in my office, I test it out, you guys. I'm not sponsored, I'm not in contract with any company, and I love that I have the freedom to do this. And if it doesn't perform, I'd probably do a video saying that, oh, you know, I didn't really work out that well. The results didn't last. I was really excited about it, you guys, but the results really weren't impressive and they were underwhelming. But I really was impressed with this result, and I'll include photos and videos of my patient who I treated as well to share these results with you. And I'll do a follow-up video maybe in 3 months after she gets a second and third treatment so that I could share this data with you. But so far, I'm really excited and really hopeful about this safe alternative to tear trough filler for under eye rejuvenation. So benefits of EZ Gel is it's 100% natural. There's no additives that are added to the product. It provides more stem cells than regular traditional PRF or PRP. And there's 15 or more growth factors that are available in the EZ Gel product than there are in regular PRF or PRP. And this is what the company had stated to me when they came to the office. Another thing is that fibrin scaffolding or structural support gives that long-lasting result. So the growth factors, the stem cells, can also, induce collagen stimulation. And whenever we have collagen stimulation, we get tighter skin, we get smoother skin, we get the diminished appearance of fine lines and wrinkles. There's also a lightening of under eye dark circles, which can come from underlying vasculature or just kind of like the shadow effect of having some volume loss in that area. And you get volume restoration as well. So these are all things that we'll see up to a course of a year and hopefully more with EZ Gel treatment, usually 3 treatments spaced 1 month apart. So what can one expect when coming in for EZ Gel treatment? Usually you'll come in and you'll have a blood draw, which is usually painless when you have a good phlebotomist. And as your blood products are being processed, you wait, I think it's about 20 to 30 minutes, and then your provider will come in, and usually a cannula, which is basically an instrument that we use to minimize bruising, swelling, and it's a little bit safer than using a traditional needle. Usually a cannula will be inserted, usually, kind of ectopic to or out of the location of the area that's being treated. And the cannula is a dull instrument that if it encounters a vessel, we'll just move it right out of the way and you minimize your risk of intravascular occlusion. But even if the EZ Gel gets into a blood vessel, it's a blood product anyway, so it's a safer alternative and the risk is lower than with your traditional hyaluronic acid filler. But the cannula is inserted and basically just kind of distributes the product into the area where there's volume loss. So if you can see the orbital rim, which is the bony part of your skull that's around the eye, then usually just kind of softening that up will have immense rejuvenating capabilities and will you look more vibrant, refreshed, younger, healthier, more awake. It'll look like you took a nap. So basically when we treat one side of the face, I usually give my patients a mirror and we compare it to the other side, and then they'll say one side looks like they're sleep deprived and the other side looks like they took a nap. So that's really what it looks like. You don't look different, you don't look pillow faced, you don't have small squinty eyes, it doesn't change the shape of your eyes, you just look refreshed and rejuvenated, and it's a really beautiful natural looking result. So after we inject the EZ Gel into that area, then there really isn't any, swelling or bruising. I can only speak for myself as an injector. My patients are never bruised or swollen. If you go to maybe a less, qualified injector, you may have some swelling or bruising. So I'm just speaking for myself and my own experience with this treatment, and same with tear trough filler as well. But it should be a very easy treatment, and there really is little to no downtime. I usually have my patients avoid heavy lifting, bending over, and exercise for about 24 hours later, but it really won't have any long-term, limitations or downtime. So it's a really quick and easy procedure, and one that I really recommend to patients who want to shy away from fillers or just want to try something more natural for under eye rejuvenation, especially if there's bags or if there's volume loss there. And what happens with bags under the eyes, it's usually herniation of the fat pad that's juxtaposed to an area where there's volume loss. And when there's a discrepancy between the eyelid cheek junction, it just makes us look old or tired or sickly. And by just kind of smoothing out that eyelid cheek junction transition, it just can really be really rejuvenating with a really beautiful outcome. So that's for my beauties who are interested in treating that area of the face. Also, fine lines and wrinkles get better, under eye dark circles get improved, and again, it looks very, very natural, and it's using your own blood products, so it is natural. So just for the sake of completeness, what are the other alternatives? If we were to do tear trough filler, usually what I do is I do a little bit of lidocaine in the area where we're going to insert the cannula, same way as we inject EZ Gel, but instead we distribute the tear trough filler in that area. Now, if you're going to have a fat transfer, usually the plastic surgeon will do it in an operating room. Usually there is either general anesthesia or twilight anesthesia. They harvest the fat from an area like, the midsection or medial thighs or the flank, and then they process the fat and they inject it into the tear trough area. And this is usually accompanied by a surgery, usually a facelift or a lower lid blepharoplasty or endobrow lift or what have you. And usually the fat graft will take about 30%. So if they inject 100% of the fat, usually only 30% takes, and that is hit or miss. So it's a big production and it comes with risk, definitely a lot more risk than EZ Gel. That's a quick and easy procedure in the office that you could do on your lunchtime break. And it has more reproducible outcomes and higher than fat grafting response. So I think it probably is, comes with a lot of benefits and minus a lot of the risks and complications that can come with fat transfer. But again, a fat transfer will probably last for 10 to 20 years, where EZ Gel may only last for about a year. Another alternative is just regular PRF or PRP, where you still get your blood taken, it gets spun down, it's just processed differently, and it gets injected the same way as EZ Gel, but the results last maybe a couple weeks, maybe a month if you're lucky. So I would definitely recommend EZ Gel over just traditional PRP or PRF. I also want to say that my son had to be put to bed, and while I was putting him to bed, my daughter came up and wanted water. So it's been quite a night trying to get this video done for you. Also, I had my eyebrows microbladed and I have Aquaphor like all over my skin and my face. So if I look a little different, I know I'm going to get some comments on it. That's why. All right, you guys, I love you. I'll see you next week.